So today our topic is 4010 multiple pregnancy. That means multiple means more than once. There is another rule that is twin is 1 in 80. The triplet 1 in 80 square. That is, for the quadruplets 1 in 80 3 to the power 3 t to the power 3, that is. So it is higher incidence is like this. Okay, so why the twin pregnancy occurred? Ki mone hoy tomader? Why twin pregnancy? So at first, yes, always should think the brainstorm should be there, should be. So there is in twin pregnancy obviously 2 fetus. So mostly that is dizygotic is 80% and 20% is monozygotic. Dizygotic means 2 separate ovum coming from 2 separate graphene follicle by ovulation and fertilized by 2 spermatozoa. So dizygotic 2 separate things, and so placenta 1 or 2? 2, very good. And most of the time 2 placenta fused at the margin and looking as a single, so become a large placenta. And monozygotic is single ovum, single sperm fertilization, but after fertilization there is division of the zygote, so it becomes monozygotic. So monozygotic is placenta how many? Always single. But amniotic cavity in amnion may be single, maybe 2. That is, if 2 die amniotic, or if 1 mono mean 1, monoamniotic, diamniotic, monoamniotic. So these are the some idea about the placenta and membrane. So in diabetes always there is 2 separate placenta, or 2 separate placenta become fixed, make a single, and about sex, what you tell? Monozygotics, same sex. Monozygotic, same sex. Dizygotic, either mostly different sex or maybe same sex, maybe possible. Okay. Now, what I tell you, that is, so in your friends, one is we found one. Would you tell us any history of from your mother, any complication or anything of you? Preeclampsia chilo, that's all. Preeclampsia chilo, আর কি বলছে blood লাগছিল তোমাদের ডেলিভারি সময়? Preeclampsia chilo, that is about 20 more than 20% preeclampsia. Okay, thank you. So anemia is also common. Preterm labor is common, and operative intervention also common. So anemia, preterm labor, operative intervention are so common. Now you can go to that first, to the etiology. Etiology কি মনে হয় কোনো কারণ থাকতে পারে না? বেশিরভাগ দেখা যায় যে কিছু আমরা যেগুলো কোরিলেশন পাই সেটা হলো যে রেস নিগ্রোদের বেশি, তারপর হলো যে জেনেটিক প্রিডিসপোজিশন, তারপর হলো যে elderly age, more than 35 years pregnant, or more para, more than para 4, 5 like this, then it is more common. So sometimes these are the correlation, and nowadays more incidence of the twin pregnancy. Why? Nowadays more taking of ovulation induction. They take more ovulation induction drug now. They are hurry up. All are hurry up about pregnancy. When they plan, they should be hurry up. No waiting. So there is ovulation induction and reproductive assisted reproductive technique, that is IVF. In case of IVF, they implant 2, 3, 4, 5 zygote implanted in the uterine cavity. As there is chance of missing, so they implant more. Then ultimately, when grown up, then they choose the selected fetus, and there causes fetal reduction. Others they demise, they make demise, keeping the healthy embryo. Now we can talk about the sign symptoms. देखबा जे तुम्हार दुईटा बाच्चा ताई ना तीनटा बाच्चा ताहले डिमांड बेशी ताई ना माয়ের কষ্ট বেশি মাকে বেশি এফোর্ট দিতে হয় এবং ফিজিওলজিক্যাল চেঞ্জেস দ্যাট ইজ ফিজিওলজিক্যাল চেঞ্জেস ডিউরিং প্রেগন্যান্সি উইথ দ্য মাল্টিপল প্রেগন্যান্সি কি মনে হয় ওরা প্রথম যে মাইনর এলিমেন্টস অফ প্রেগন্যান্সি দিস ইজ নশিয়া ভমিটিং যা যা আছে এগুলো কি হবে বেশি হবে তাই না ওয়েট গেইন বেশি হবে ডিসপনিয়া বেশি হবে তারপরে শর্টনেস অফ ব্রেথ বেশি হয় তাই না মাদের কত কষ্ট করতে কারণ দে শুড অ্যাডপ্ট দ্য চেঞ্জেস ব্লাড ভলিউম বেশি যার জন্য পালপিটেশন বেশি হয় এগুলো মাইনর এলিমেন্টস তারপর ধরো যে পেশেন্ট আর কি প্রবলেম হতে পারে ওদের মাদের কি বলে ওরা তোমার other complication মানে other sign symptom depends on the complication if there is complication mostly you can the complication during pregnancy complication during labor and complication in puerperium so if we think that is complication during pregnancy কি হবে তাহলে that is preeclampsia and anemia and others are preterm labor okay preterm labor and then what are the other sign symptoms and if she suffer from any medical disorder it will exhibit then during pregnancy and during that is labor what would be the preterm labor there is every possibility before that I want to tell again to the pregnancy that antepartum hemorrhage is more common antepartum hemorrhage why antepartum hemorrhage is more common in multiple pregnancy that is you think that 2 or 3 fetus so large placenta there may be partial separation of the placenta may be in the lower uterine segment that is so placenta previa incidence of the placenta previa is more so there is possibility of the antepartum hemorrhage and sometimes that is associated with folic acid deficiency also causes placental separation শুনতেছো সব folic acid deficiency causes placental separation that is called abruptio placenta okay and also there is in hypertension that is preeclamptic toxemia PET there is vasoconstriction and ultimately it causes earlier separation of the placenta so many factors of the antepartum hemorrhage and most of the time associated with anemia so every possibility of any disorder anemia predisposes any disorder that is anemia is called silent killer of our body so these are the factors of the abruptio large placenta and antepartum hemorrhage large placenta folic acid deficiency and what preeclampsia anemia very good these are the factors okay now if we go to the during labor that is preterm labor difficult labor instrumental delivery and possibility of the instrumental delivery you saw in the picture the breech delivery if most of the time if you think two baby then presentation what is common always think natural better is vertex so vertex is more than about 70% more than 50% vertex and vertex breech that means first baby vertex second breech then breech 10% like this okay so more than 50% is vertex then vertex breech then breech then vertex transverse like this so these are the common presentation so malpresentation also one of the complication, malpresentation. ठीक है? Then malpresentation and then instrumental intervention I told already, and increase incidence of the cesarean section. Why? Most of the time there is complication and most of the time there is malpresentation of the second baby, usually common, but we can allow breech. If birth is breech, then we can allow the normal delivery, okay? So these are the complications during labor. And then immediately after that, there is a preterm, the premature rupture membrane. Do you understand from behind? Why there is rupture membrane? Yes, more distension, more stretching, and at any time maybe rupture of the membrane. This is more so common, preterm labor is so common. That is premature rupture of the membrane. You think if there is two fetus, if rupture membrane, then what is the possibility? There is cord prolapse. Most of the time, the possibility of the cord prolapse. That is one of the more complicated situation, cord prolapse. Why? Immediate need of immediate cesarean section. Okay. I again want to go to the back. That is what may be the outcome of the two fetus during pregnancy. দুটো বাচ্চা কি কি প্রবলেম হতে পারে? একটা হলো যে তোমার that is fetal outcome. Number 1, miscarriage. Number 2, demise fetus. That is একটা বাচ্চা আরেকটা বাচ্চার থেকে কম্প্রেশন হয়ে বা অন্য কোনো কারণে প্লাসেন্টাল অ্যাবনর্মালিটিস বা মোলার প্রেগনেন্সি চেঞ্জ হতে পারে, আরেকটা বাচ্চা সো দ্যাট ইজ পার্শিয়াল মোলার প্রেগনেন্সি হয়ে যেতে পারে. সো দ্যাট ইজ প্রবলেম টু দ্য এনি অফ দ্য ফিটাস. অ্যাবর্শন, ডিমাইজ ফিটাস, death, that is vanishing twin. You know the vanish. That is vanishing twin means one fetus is dead, another fetus survive. That is also may happen. Most of the time that is monocorionic. If that is monozygotic twin, most of the times sometimes that is one twin may be finish হয়ে যায়. And some of the times resorption of the death occur before 14 weeks, maybe another time is papyraceous, fetus papyraceous, paper-like, papyraceous. You find out in the book, the fetal papyraceous fetus become death হয়, thin হয়, compressed হয়ে একটা paper-like সাদা দেখা যায়. Papyraceous. This may be the outcome. And another that is more important for you, twin transfusion syndrome. Twin transfusion syndrome, that is what mean that is? Twin মানে একটা বাচ্চা থেকে ব্লাড আরেকটা বাচ্চা চলে যায়, তাই না? হয় কখন চলে যেতে পারে? If there is deep-seated arteriovenous anastomosis between the two fetus. Is it possible? Yes, through placenta, it is possible. Placenta, arteriovenous anastomosis. So one fetus get more blood, another is deprived. So that is get more blood, he become hypervolemic, polycythemia, maybe change with hydrospitalis like this, and another is deprived. So become IGR, even death may occur. Like this. So, is any management for this? Yes, if venous anastomosis, anastomotic region, if we laser ablation, with the laser ablation, we can block this anastomotic area, okay? Or any other surgical operation.